Hello and welcome. Did you know that more than 500 million people worldwide are living with diabetes? That's a staggering number and it's still rising. But here is the good news: with the right knowledge, diabetes can be managed, and in many cases, even prevented. In this video, we'll cover everything you need to know: what diabetes is, the different types, warning signs, complications, how it's diagnosed, and most importantly, how to treat and prevent it. So, stay with me for the next 10 minutes. It could change the way you look at your health. So, what exactly is diabetes? Simply put, it's a condition where the level of sugar, or glucose, in your blood is too high. This happens when your body can't produce enough insulin, or when the insulin it makes doesn't work properly. There are three main types of diabetes. Type 1 diabetes. This is an autoimmune disease. The body's immune system mistakenly attacks the cells in the pancreas that produce insulin. It usually develops in children and young adults, and people with type 1 need insulin for life. Type 2 diabetes. This is the most common type, making up about 90% of all cases. Here, the body becomes resistant to insulin, or doesn't produce enough. It's strongly linked to lifestyle factors, but genetics play a role too. Gestational diabetes. This type occurs during pregnancy. While it often disappears after childbirth, it increases the risk of both mother and child developing type 2 diabetes later in life. Together, these types of diabetes affect people of all ages, backgrounds, and lifestyles, making it one of the biggest health challenges of our time. How do you know if you might have diabetes? There are several warning signs to watch for: feeling very thirsty, all the time. Needing to urinate more often, especially at night. Sudden weight loss without trying. Constant tiredness or lack of energy. Blurred vision that comes and goes. These symptoms may seem harmless at first, but they shouldn't be ignored. If you experience them, it's important to see a doctor for a simple blood test. Why is diabetes such a serious condition? Because if it is not controlled, it can cause damage to many parts of the body. Some of the major complications include heart disease and stroke, kidney failure, which may require dialysis, eye damage, leading to vision loss or blindness, nerve damage, causing pain, numbness, or dangerous foot ulcers. The truth is, uncontrolled diabetes shortens lives and lowers quality of life, but the good news is, with proper management, many of these complications can be prevented. Diagnosing diabetes is simple. Doctors use blood tests such as fasting blood sugar, also called FBS, the oral glucose tolerance test, or OGTT, and the HbA1c test, which shows your average blood sugar level over the past 3 months. These tests are quick, widely available, and can help detect diabetes early, before complications develop. Once diagnosed, how is diabetes managed? For type 1 diabetes, treatment always requires insulin therapy, along with careful monitoring of blood sugar levels. For type 2 diabetes, many people can start with lifestyle changes like eating healthier and exercising regularly. Some may also need oral medications, and in later stages, insulin as well. Regardless of the type, here are the golden rules for managing diabetes. Eat a balanced diet rich in whole grains, vegetables, lean proteins, and healthy fats. Exercise at least 30 minutes a day, most days of the week. Take medications or insulin exactly as prescribed. Monitor your blood sugar regularly to track progress. New technologies, like continuous glucose monitors and insulin pumps, are making diabetes management easier than ever before. The best strategy is prevention, especially for type 2 diabetes. And prevention is absolutely possible. Here is how. Maintain a healthy body weight. Be physically active, walking, cycling, or even dancing all count. Eat more whole foods, fruits, and vegetables, and cut down on sugary drinks and fast food. Avoid smoking and limit alcohol. Simple lifestyle changes can cut your risk of diabetes by more than half. Remember, prevention is always better than treatment. So, let's recap. Diabetes is common, but it doesn't have to control your life. By understanding the disease, recognizing the symptoms, getting tested, and making healthy choices, you can take control of your future. If you found this video helpful, don't forget to like, share, and subscribe so more people can learn how to protect their health. Stay healthy, stay strong, and take care of yourself. Thank you for watching.